Welcome to today's episode of Motors and Medicine. Today I'm going to be discussing patellar dislocation or kneecap dislocation to keep it simpler. So, what exactly is kneecap dislocation? Well, for starters, you have to understand what your kneecap is, what it does, what its main purpose is, and then understanding the dislocation makes a lot more sense. So the kneecap is, like everybody knows where their kneecap is. That's that little semi-movable bone that's on the front of their knee. Its main job is to act as an attachment site for muscle on one end and ligament on the other end. And what that kneecap does is it allows a gliding motion back and forth when your knee is being extended and then back into a flexed position. So the muscles of your quadriceps attach to the superior most or the topmost portion of the kneecap, and then they act on the patellar ligament, which goes from the inferior portion of the kneecap or the patella down to the anterior portion or the front portion of your tibia or your shin bone. And so having that connection there, when you activate the quadricep muscles into extension, then your knee acts as a rotating fulcrum. And so when that muscle contracts in your quadriceps, your leg extends into a straight position if you're in a bent position to start with. And the kneecap kind of just acts as a glide. It kind of sits in this groove of the longer bone of your thigh, which is called the femur. And at the very end of that femur, there's like this V-shaped groove or valley where the kneecap lives. And the kneecap also has a corresponding V shape, so it slots right into this valley. And whenever it is being pulled back and forth, whenever the quadriceps are being contracted or relaxed, your knee is being extended or being flexed. That's kind of what provides stability during that motion of flexion and extension. So that's in essence what the kneecap's purpose is. Now, what is a patellar dislocation or a kneecap dislocation? Well, it is an incident where the kneecap is forced laterally or to the side, to the outside of your body. So if we think the body is one section, toward the midline of the body is medial, and then away from the body is lateral. So in essence, the kneecap takes through some type of force a lateral movement, and it actually, if you remember that description, that it sits in a valley shaped like a V, and the kneecap is also kind of V-shaped. But in the process of some type of force or trauma, the kneecap can actually jump over that rail and kind of get dislocated off to the lateral side. This particular incident is quite painful and usually doesn't require any manual manipulation to put it back in. Typically, when a kneecap has been dislocated, as long as the leg is extended back into position, the kneecap will then jump back into its valley and be relocated or reduced back into position. But the process of that dislocation looks like this following image. And the potential damage that occurs from the dislocation looks like this particular image. Now, these images illustrate how the kneecap looks when it's been dislocated and the damage that occurs. Typically, when the kneecap is dislocated laterally, it requires a pretty strong valgus force where the knee is actually turned inward towards the body. That's a valgus force. And the muscles of the quadriceps are also contracting very hard at the same time when the kneecap is, or when the knee is being valgusly pressed in toward the midline. That's going to cause the kneecap to want to go laterally or outside, out of the midline. And this can happen in a number of instances. It can happen, for example, it has happened to football players when they're hit on the outside of their knee, causing their knee to buckle inward, and the kneecap can then go outward. That is one example of a mechanism of how it can happen. However, dislocated kneecaps or dislocated patellas happen far more frequently in women. The reason for this is that women have inherently wider hips than men, and because of that wider hip, there is a change of their Q angle. And what is Q angle? Q angle is just a simple line or measurement. It's a line taken from the lateral hip down to the inside of the knee, and the angle that forms, that is called a Q angle. And if women have wider hips, then their Q angle is going to be more magnified. And that angle basically pertains to the line of pull of the quadriceps musculature. So the quadriceps, you ideally want them to pull in a straight line if you're very healthy and strong. But many people, especially women with the Q angle, their lateral quadriceps end up pulling outward instead of straight. So you have a much stronger pull or line of pull going outward instead of straight. And that line of pull is going to stress out the kneecap, and it's going to want the kneecap to go laterally to begin with. When you couple a valgus force coming from the outside of the knee, and then that violent contraction of muscle pulling it the opposite direction, that can explain why the kneecap pops out of place so easily, and it happens more commonly in women. Now, this can also happen to men who do not have an exaggerated Q angle, but again, it's because there's a very violent amount of force put on the outside of the knee, forcing it into a valgus position, which then makes the kneecap want to pop laterally. So, why does this happen? Well, a big portion of, or a big reason or contributing factor to why the kneecap dislocates so readily is in part due to our biomechanical structure, how we are built. Our quadriceps muscles, it's a 3, and that's actually a 4 group muscle, why it's called the quadriceps. There's 4 muscles. And there's 2 on the outside, 2 in the middle, or rather 1 on the outside, 2 in the middle, and then 1 very short strand of quadricep on the inside of the thigh. But the vast majority of the muscles making up the quads are all on the outside, the vastus lateralis, what we call it. It is a very large portion of the thigh. And because it's so strong, it is hard to keep the patella tracking straight when that muscle contracts. Because if you think about it, mechanically speaking, the vastus lateralis, or that outer thigh or quadricep, is on the outside of your leg. So when it pulls, it's going to want to pull at an angle. The only muscle that really opposes the kneecap going laterally is the vastus medialis. And the vastus medialis, or the VMO as we call it, is a very short muscle on the inside of the knee or the inside of the lower thigh. The issue is that most people have exquisitely strong vastus lateralis and even the vastus medius and intermedius muscles, but the VMO, or the vastus medialis, is a very weak muscle in most people. There are exceptions to that rule. If you've ever noticed that runners or cyclists have really big muscles on the inside of their thighs, that muscle that almost kind of hangs over on the medial side of their knee, that's the VMO. And in bicyclists or runners, people who do a lot of squats, they have really strong VMO muscles. And that vastus medialis, when it's really strong, it really helps to maintain good, straight, linear tracking of the patella when the knee is being bent or flexed. So that is the best method, or the best way to prevent the kneecap from dislocating, is to strengthen the VMO and to keep the lateral muscles of the thigh nice and stretched. You do that, and the kneecap is always going to want to track straight when you are putting it under whatever type of force or stress. And it will also resist that want to dislocate if you are put in a situation where, let's say you're a football player and you get hit on the outside of the knee, causing it to buckle inward, and the kneecap wants to go outward. That type of strong musculature on the inside of the thigh can help prevent that from happening. Now, there are other methods to treat this condition. Obviously, the first conservative is just strengthening that VMO and keeping that lateral musculature nice and stretched. However, in some cases, when that kneecap dislocates laterally, as you saw in one of those previous images that I illustrated, there's a ligament structure that usually holds the kneecap pretty straight. It's called the medial patellofemoral ligament. And this ligament can tear, as I illustrated in that previous image. If that tears and it doesn't heal very well or scar down very well, then there's going to be quite a bit of laxity or looseness in the kneecap. So it's going to have an easier time or a higher propensity for dislocating laterally. So one thing that can be done is there's a couple of surgical procedures that can be done. I'm going to illustrate one of the more popular procedures being done now, and that is where you drill into the kneecap and then drill into the medial side of the femur and attach a ligamentous band that you harvest from either the hamstrings or from some other part of the body, and you use that as an anchor and anchor that kneecap more medially so that there is a less likelihood that it's going to dislocate laterally. And I'm going to illustrate these images now. So these images show what that would look like if you had that surgery performed. There is another procedure that's a little bit older called the Fulkerson procedure, and that's where the lower portion of the patellar ligament, where it attaches on the tibia or the shin bone, that lower portion is actually moved to a different, more medial section of the tibia. But this surgery is not as popular as it used to be. It's a little bit more difficult to recover from, and it's exquisitely painful. It's a little bit more invasive as well. So these are the surgical repairs, if you will, that can happen when this injury occurs. Now, one thing to keep in mind is this injury can happen with a lot of force or with little to no force at all. I'll give you an example. This particular injury happened to my very own daughter. She simply was just bending down to reach to pick something up off the ground, and she buckled her knee in a position where her knee went inward, similarly to what would happen if she had been hit on the outside of the knee if she had been playing football, and her knee took on that valgus position, and her knee went in. But when she was trying to stand back up, her quadricep, because she used to play soccer and had such strong quads at the time, quadricep contracted really hard on her way up, her kneecap popped out of place. And that didn't require a whole lot of force, but it happened. So in her case, when as soon as she straightened her leg, the kneecap reduced itself back into position. But she did a fair amount of damage. So it took some time for her to get over that. And getting over a dislocation can take months, if not almost a year in time, before you build that tissue back up. Fortunately, in her case, she did not have to have surgery. But people who dislocate their kneecap after about the third dislocation, where you have little to no stability and too much laxity of that kneecap, where it's not tracking straight and it wants to go side to side more frequently, in an instance like that, you have now become a good candidate for surgical fixation. So hopefully this information was helpful. And if you happen to be involved in a situation where you're doing a lot of exercise, you're going back and forth, you're hiking, whatever it is, keep in mind that you want to keep a nice and strong VMO to prevent your kneecap from dislocating laterally. hopefully this information gives you some good illustration of what the condition is, what it looks like, how it's treated, how to prevent it. And until next time, I really appreciate all of your support, and I appreciate all the people that have subscribed to the channel. If you haven't had a chance to subscribe, please do so. If you like this video, please give it a thumbs up. And on the next video, I'm going to get back into the motor side of things, and we're going to be doing the video I promised you on all of the modifications I've done to the Bronco thus far and how they have held up. So until then, this is Motors and Medicine signing off. Thank you.